Thank you very much for this kind welcome and return invitation. And about 2 months ago, Ms. Wilson contacted me and asked me to prepare a subject. So the usual doctor procrastinated for about a month. So I did not want to commit to a subject, so I titled that subject RF. And nobody knew what RF stood for. If you look at the program, you would not know what that RF stood for. And it's actually random facts. So I said, this is something that I can create anytime I want to, whatever I want to. Which is interesting, but it's really a subject that is very dear to my heart to talk about we humans and how did we evolve into the diseases we have today. And what do we need to do? And some random facts about these diseases and how do affect us and affect our community. My name is Oussama Rifai, and I am a nephrologist and also have a passion about education and global education. Our website is thevirtualnephrologist.com, and you can always like us on Facebook as well. So the subject is, we are here today. This is Monday Night Football. Saturday afternoon college football with dips and chips and a remote control and whatever drink you think that is. About a few thousand years ago, we were living like this. Today, this is how we are living, no matter how you look at it. So I wanted to really shed some light with random facts about the disease that affect this individual. So when we look at life expectancy, and we look at life expectancy long time ago, it was fairly short. Childhood illnesses and early death, midlife diseases, different illnesses, lack of healthcare facilities and social structures to support people. So life expectancy was in the 20s and 30s. Up till about the turn of the last century, which is the 1900s, that where life expectancy started to be extended and people lived longer. Now we have hospitals, we have penicillin, we have vaccinations, and we have ICUs, and we have ventilators, and of course we have dialysis. So that would have made a difference as well if dialysis was available probably 2,000 or 3,000 years ago. But now, sadly, we are starting to see the curve going backwards and a possible risk of decline in life expectancy. And I wanted to shed some light with some random facts about why this is happening. The first disease that we have, and the most common disease, is called hypertension or high blood pressure. This is the most common disease on the face of this earth today. Meaning that if you are born, the odds are the one disease that one of you will get at one time is hypertension. 1 out of 3 American adults have hypertension. 1 billion people worldwide have hypertension, and this is the most common cause of death. Hypertensive heart disease, hypertensive kidney disease and dialysis, hypertensive dementia, hypertensive congestive heart failure, hypertensive abdominal aortic aneurysm and rupture. So really it is a common disease, and it has its complications that lead to death. One of the reasons that hypertension has become very common, certainly we have some genetic factors, we have social factors, we have cooking factors, and we have psychological factors, and stress can lead to hypertension. But one of the most causes is actually the way we are eating today. We are salting our foods to preserve it, because now we have many people on the face of this earth that we have to feed or transfer the food from one place to another, or mass quantities. Brining, which is another process of how we preserve the food, which is soaking the food in salted water and drying it. And that's a way to preserve the food for the summer and for the winter and for the tough times. And that all by itself can lead to hypertension as well. So when hypertension gets untreated, these are the potential complications. People have had a stroke, whether it's hemorrhagic or thrombotic. Hemorrhagic means a blood vessel ruptures and people bleed inside their brain, and we certainly see this frequently for people who have severe hypertension. Or thrombotic, where the blood vessels, because of the hypertension and the damage of the lining of the blood vessels, eventually that lead to clotting and thrombosis inside these blood vessels that lead to stroke. And we have a fair share of these patients that we see almost in the neurointensive care unit as well as the neuro floors. Heart disease and heart failure. Heart failure, even though it may not sound as bad, but here's one random fact that is a simple statistic. Anybody who is diagnosed with congestive heart failure, they have a 50% mortality in 5 years. More than breast cancer, more than diabetes, more than AIDS, and more than colon cancer. So really heart failure is a serious disease that needs to be attended to, and one of the reasons that can lead to heart failure is actually hypertension that is not well controlled. Kidney disease and kidney failure and dialysis. I have some good news and I have great news to the world and from the community of nephrologists and the dialysis community. About 30 years ago, when dialysis was covered by the government, there were only 1,000 patients that were enlisted to undergo dialysis. Medicare paid in 1972 only for 1,000 patients. Today, there are 500,000 dialysis patients that are on dialysis today that are a result of untreated hypertension and diabetes. But the good news is now we understand hypertension. The nephrology community has been very aggressive in managing hypertension, and the number of new dialysis patients is starting to decline. So we have actually, as a nephrology community, been successful in curbing that steep uprise, and we've been able to plateau it, and now it's starting to decline, which is very good news in a way, but also those patients will have advanced kidney disease and will live with their many other illnesses. Vascular disease or arterial disease is common as a cause from hypertension, and people who have aneurysms, ruptured aneurysms, could be the result of hypertension as well. And of course, dementia is another disease that as we age, a lot of people will have dementia, but we don't need to have hypertension or untreated hypertension that can make this problem worse. So looking at this, these are facts that if we don't treat hypertension, we're looking at these complications. So one of the things that I've found in the past 20 years of my clinical practice is the way patients check their blood pressure. One time I had a young lady who's 19 years old who was referred to our practice for hypertension management. Her blood pressure was 150/100. So when she came in, I said, I wanted to see you again to recheck your blood pressure. So she came in running through the doors, then went to the nurse's station, sat down and wanted to have her blood pressure checked. And she said, Doc, hurry up. I got the car running and I got 3 kids and a dog in the back and so forth. So that in by itself is a way to get your blood pressure through the roof. So there are guidelines that we need to follow to check the blood pressure. You need to be relaxed for at least 5 minutes. You need to be comfortable, not cold, not stressed. And you need to be not checking your blood pressure 2 hours after a big meal. And no coffee, no smoking, no exercise. And you do not use wrist monitors. Most wrist monitors are made in China, and we will be supporting the Chinese economy when we buy those. When we buy those and use them, they are unreliable, and most of the standards that hypertension community, medical community have really came up with is actually arm blood pressure cuffs, not wrist cuffs. And you have to be seated in a chair that supports your back and supports your arm. The arm has to be at the heart level, and your ankles should be on the floor, and do not cross your legs. So this is a classic diagram on how you should check your blood pressure. Now record these readings and take them with you to your doctor, because those readings won't help the doctor If you check them and then when you go to the office, you're nervous, you could not park, you have an outstanding bill, you got into a fight with the secretary, and now your blood pressure's through the roof and the doctor's adding more medicine, but actually at home your blood pressure is 110/70. So check your blood pressure, record it, and carry it with you. A lot of times the way we treat hypertension, first thing should not be medications, should be diet, natural and unsalted foods, you exercise, you quit smoking, and certainly if you cannot get your blood pressure to target with these measures, it's very important to take medications to really make a difference in your life. But most importantly, get back to that caveman who was carrying a bushel of barleys and was walking to get something to eat, not sitting in a recliner with a remote and a beer and a bag of chips and salsa. The next disease that really has happened as well to us while we have become urbanized or civilized, or we no longer are cave people, is actually metabolic syndrome and its continuum leading to diabetes mellitus. Now there's plenty of food available. We throw away enough food to feed the rest of the world per day. There is abundance also of unhealthy food. All what you have to do, walk into a store and find out how many boxes of chocolate and donuts and chips they have on the shelves that can feed also a lot of people. Our fast food has become part of our life. I've got to run there, pick up through the drive-through and get some food and come back and work on my desk. Junk food and TV style, obesity and diabetes has become common, and nature has got upset with us. We have abandoned the healthy and the natural foods, so nature decided to punish us with obesity and diabetes. And diabetes is not an easy or simple disease. Diabetes is really a painful disease that with time, people will live a long life, yet will have a lot of complications. These complications could be blindness. Random fact, diabetes is the #1 and the leading cause of blindness worldwide. So untreated diabetes can lead to this, and keep in mind, we chose to leave the go after the food into living on the recliner with complications of diabetes, kidney failure and dialysis, heart disease and heart attacks. Some people, some cardiologists think that diabetes is the root of coronary disease or some form of insulin resistance. Strokes. For women, diabetes leads to polycystic ovarian syndrome. And for men, it leads to ED. So the question is nature trying to punish the people who really will leave the natural foods and make them not be able to have any more children and have another generation who will do exactly what their parents did? I don't know the answer to this, but I could not ask the nature, but that's a question. Comes to mind. Sometimes you have a pet at home, and you have a pet at home and you get a recommendation from your physician to walk the dog every day. And literally, he's walking the dog every day. But it is about you. It is not about the dog. It is not about the doctor. The next interesting subject that also is a random fact that this is how we have evolved is actually vitamin D. We live in Florida that is, if you look at the license plate, it says the Sunshine State. Who lives in Florida? I don't. The reason is we live under a roof, and that roof is preventing us from being adequately exposed to the sunshine and get adequate amount of vitamin D. A lot of people think that vitamin D is only a bone and calcium and growth vitamin. There is 1,800 receptors in the body other than the bone and the calcium that really are activated or deactivated by vitamin D. These could be cancer genes, risk of prostate cancer, breast cancer, ovarian cancer, lung cancer, risk of diabetes, hypertension, and depression. All those can be mediated by some form of vitamin D. Allergies, obesities. You hear the term fibromyalgia. Who have not heard the term fibromyalgia? Raise your hand. Good, because if you said no, I can assure you, you have heard it today. So now everybody knows fibromyalgia. Fibromyalgia is a disease that really has taken a lot into our medical community, requires a lot of medication, but there is a similar disease called osteomalacia, and you cannot differentiate symptoms. It's aches and pains and burning, deep pain, but osteomalacia is related to vitamin D deficiency. So is there an overlap? Is there an opportunity to take adequate vitamin D to really help your symptoms if you're having osteomalacia and not actually fibromyalgia? So sometimes polycystic ovarian syndrome is mediated by vitamin D deficiency based on insulin resistance. Fatal infections, people who take vitamin D this year, next year will not have bronchitis or flu or runny nose or cough in the winter. It improves the immunity. People who have repetitive upper respiratory infections could be vitamin D deficient, and taking vitamin D will make a difference for you. So is the nature and the sun jealous that we're not coming out to be with her, so they're taking away our vitamins? Certain ethnic groups are at a big risk of having vitamin D deficiency. So let me have a poll and ask the following questions. Do you think Africans have a higher rate of vitamin D deficiency than Caucasians? Is that a yes? And what is the reason? Does anybody know? Okay, here is the theory. Here's the theory. And that's a random, it's not a fact, but it's a random theory. When an African person lives in Africa, there is sun from 5 a.m. till 9 p.m. So they make vitamin D very slowly. And God has given them a layer of melanin to protect the cells that make vitamin D from making a lot of vitamin D. Otherwise, it'll become toxic. So they make enough vitamin D throughout a period of 14 hours. On the other hand, you take a Scandinavian person where the sun is out for only 7 minutes. That person make vitamin D, all what they need, in 7 minutes. So when you take that African person, put him under a roof, put him in Alaska, put him in the basement, and deprive them from all that long period of sun, that leads to a profound vitamin D deficiency. And we are seeing a pandemic of vitamin D deficiency and vitamin D deficiency complications, hypertension, obesity, depression, diabetes, as a result of everybody not being adequately exposed to sun. So maybe this is the reason why the African American community here in the United States is at a major risk of having these diseases that are related to vitamin D deficiency. Now, animals know they need vitamin D, plants, and even sometimes people like this one will hold it upside down and will still want to catch some sun to really get adequate amount of vitamin D. We really feel a whole lot better after a day on the beach, even though we're exhausted, but really the mood is uplifted, we're relaxed, and we feel fairly well. And that's all the effect of the vitamin D. So is nature jealous when we go out and cover or hide from the sun beam and ultraviolet lights that make vitamin D? Nature will give you accelerated coronary artery disease. There is now a relationship between vitamin D deficiency and coronary disease. We will get osteomalacia, which is aches and pains, feel exactly like fibromyalgia. We will have emotional pain as well with depression, and it's called the winter blues. People who don't see the sun in the winter, people from the north. We see a lot of snowbird patients come down to Florida to get some sun and not be depressed when they don't see sun. Risk for metabolic syndrome, diabetes, and obesity. recurrent pulmonary infections and allergies, polycystic ovarian syndrome in women, and ED for men. So is this a way nature wants to punish you, give you depression and pain and ache, and not have you live your life to the fullest? So sun is good, maybe every once in a while. I know the risk of skin cancer is there, but every once in a while get a tan and really don't put sunscreen. You will feel so much better, or take your vitamin D pills. Next is about the concept of sleep, which is also another interesting concept. So if we go back to the caveman, usually men used to sleep right at the door of the cave to protect the family, the wife, the kids, that are and the elderly that are sleeping deep in the cave. So it was dark, so there is no lights, and any predators, big animals who want to come in and smell humans, they want to go eat some humans, will hear the man snoring. So they will be afraid, and they think there is a big beast protecting that cave, and they walk away. And this is the theory why men snore and women don't. And the more tired the man is, the louder the snoring is. And probably because, back to the caveman theory, that man was so exhausted, even if a beast ate him, he would not even feel it. So he had to snore louder so that he can divert the beast away. On the other hand, women had to sleep quietly. They had kids, so they really could not fall asleep in a deep sleep. So they wake up, they take cat naps, 45 minutes they wake up. And that's probably one of the explanations why insomnia is more common in women than men. A lot of women say, I sleep 2 hours and I can't sleep anymore. So is this how nature carried its behavior and its effect on humans in the cave into our civilized world? And I don't know the answer to this. On the other hand, snoring and obesity and metabolic syndrome and diabetes lead to a disease called obstructive sleep apnea. Obstructive sleep apnea can lead to hypertension and diabetes, heart disease, and for women, it really takes away the opportunity for them to live their life and have children, because nature is punishing those people, saying you cannot have children if you're going to be like this, or they're going to be like this, through the polycystic ovarian syndrome. And this is what I would call nature's revenge from these people. If you don't have bills, if you don't have emails, if you don't have homeowner association meetings, you don't have to worry about stress. Your life, you go to sleep, you wake up the next day, you go get something to eat, you go back to sleep, and that's how your life. Our life became so complicated and became so stressed, so we now have higher level of cortisol, hypertension, and diabetes, and that leads to depression. We need to find a way to learn how to de-stress our life, or to learn how to cope with these events that drive us almost to the edge. So if you're stressed, would nature punish you? I don't know the answer to this, but here's something very interesting, and I learned this not too long ago. Oxytocin. Oxytocin is the hormone that helps with uterine contractions at the time of birth, but also has other functions for individuals, males and females, that are not pregnant. Actually, love will increase the levels of oxytocin with any relationship, especially when you have oxytocin deficiency. It is the hormone of de-stress as well. Other than endorphins, endorphins are hormones that are produced from heavy exercise that can lead to taking the pain away. And this may be the reason why people will have a sprained ankle and they're running a marathon and they won't even feel it. But you don't have to put yourself through a strenuous exercise to get oxytocin. It's the hormone that can de-stress you. Any hug or a love relationship that we don't understand actually the nature of this relationship, to a new baby, to a friend, to a partner, to an animal, can really increase the levels of oxytocin in your blood and really de-stress you and make you feel better. Lack of oxytocin leads to obesity, hypertension, diabetes, polycystic ovarian syndrome, and ED. Is this a way that nature also is punishing us because we're not giving hugs or taking hugs? Now, I won't read this. I would want you to really take the time and read it while you're smiling. How true that is. Good. So work with nature and she will reward you. Good diet, good exercise, sleep hygiene. And sleep hygiene is an interesting subject that really a lot of people to sleep very well will tell you about. Don't go to the bed unless you're sleepy. If you can't go to sleep or fall asleep in 20 minutes, get up and do something else. Have a good night's sleep. Don't do anything else in bed other than actually sleep. And quote unquote. And and make your bedroom quiet, dark, and a little bit cool. Then you can have really a good night's sleep. A good night's sleep is a good relaxing method. It's rejuvenating. So after diet and exercise and good night's sleep, what else would you do? Magnesium is the most underutilized element for treatment of certain diseases that we are undergoing today. The American diet is profoundly void and deficient of magnesium. Magnesium is good for hypertension, diabetes, depression, sleep, migraine, coronary disease, constipation, cardiac arrhythmias, you name it, magnesium is good. Magnesium is the spark that initiates energy. So one other random fact that we know today, a lot of hot sauce, a lot of pizza, a lot of garlic, a lot of fatty food can lead to heartburns. Now, Prilosec is over the counter. This is one of the medication that is notorious to leading to magnesium deficiency. So patients who take a lot of PPIs, Prilosec, Protonix, can have profound magnesium deficiency that can lead to all these complications. The next good thing that we need to take, and I would recommend this, is flaxseed. And take the flaxseed powder, not the oil, not the pill, not the capsule, not the caplet, not the whole flaxseed. Make sure it's grind and take it. It has plenty of omega-3 fatty acids, and it has good effect on hypertension and heart disease, obesity, diabetes, and depression. My favorite is turmeric. It is the strongest antioxidant, anti-inflammatory agent known to man today. It is good for every form of arthritis. It has a very antioxidant activity against many cancers today. And the good thing about it, if you add it to food, it really tastes good. And I started taking fresh turmeric, and I cut small pieces and add it to water. So I diagnosed myself with the following disease. I have virtual oxytocin deficiency. Okay? And I need 4 virtual hugs. So you can like us on Facebook, and you can follow us on Instagram, or you visit our website. With this, thank you so very much. And if you have any questions or comments, I'll be more than happy to answer. Okay, let's start from Sarah.
How much sugar should you take?
It depends on what you're cooking. If you're stir-fried vegetables and your husband doesn't like a lot of spicy food, you add a little bit. I mean, it's a root. But don't take it in a pill. It's available at Publix or Whole Foods store. You just kind of cut it in small pieces, and if you like too much turmeric, it's good. If you don't like too much turmeric, whatever you like it. You're not taking it as a medicine. You're taking it as a way of life and how you cook. Ms. Nancy?
Vitamin D, I know, you said we don't get it up in the sun because the sunscreen or all that sun is in our lives. So what is the best delivery? And if you have a supplement, what is it?
If you're going to take vitamin D, take vitamin D3, 2,000 units once a day. And a lot of times when there is something that is very interesting, and with that interesting thing, you have sometimes milk that are mentioned that to be fat-free milk, and they are fortified with vitamin D, but vitamin D is a fat-soluble vitamin and cannot be there. So if you're going to take something, it's over-the-counter, 2,000 units once a day.
What about magnesium, Dr. How much magnesium should we?
For magnesium, you're asking how much magnesium you should take. There is many preparations. The best preparation I've been trying on myself, I used myself as a guinea pig to see which one is the best and did research. The best one is called magnesium glycinate, Glycinate, 400 milligrams twice a day. It has almost no side effects to the gastrointestinal tract, because if you take a lot of elemental magnesium, you will be changing your mailing address to the bathroom. Magnesium glycinate, yes, it is over the counter, and it's sold at many health food stores. And it's sold at, I don't advertise for health food stores, but every reputable health food store will have magnesium glycinate. It's a little bit more expensive than magnesium oxide, but it is worth the effort and extra few dollars to get magnesium glycinate. Yes, ma'am.
Would you mind spelling it again, please?
Spelling of magnesium glycinate, Glycinate.
Thank you.
Yes, ma'am.
So you were saying if you take like over the counter for heartburn and stuff like that, so that just depletes your magnesium. So what's a good remedy to take if you have heartburn?
So the question is, this young lady asked, what is the better remedy than what is on the market today regarding heartburn and reflux? The medications that are on the market today are divided into two elements. There is the histamine blockers or H2 blockers like Pepcid, and that is also over the counter. On the other hand, you have the proton pump inhibitors, or the other name for them is the PPIs, which is the Prilosec. So Pepcid is available, Melox is available, avoidance of that deep-fried turkey can help as well. Sometimes sleeping on the right-hand side, because it helps move the food to the opening of the stomach into the intestine. So if you sleep on the right-hand side, it will help some with the reflux as well.
Don't they automatically get PPIs when people are admitted these days for a GI prevention?
There is, the question is, hospitals will automatically initiate a gastrointestinal ulceration protocols when patients are admitted to the hospital. And it used to be PPIs as the drug of choice because they were fairly powerful. Over the past few years, we have learned in the medical community that even though they are very powerful in preventing gastrointestinal hemorrhages, but they also have their own complications. Mainly, they reduce the gastric acidity so much that now patients could potentially be at risk of having Clostridium difficile colitis. So PPIs in the hospital increase the risk of C. diff. So now most hospitals are moving away from PPIs into Pepcid and Pepcid-likes if the patient needs a gastrointestinal prevention. And unless the patient is having gastrointestinal hemorrhage, that's a different story. But for prevention, hospitals are moving away from the PPIs. Yes, sir?
Well, I've been taking flax seeds since last year every day.
Uh-huh.
And then I take yeast flakes every day for vitamin B. And also, well, I asked the question the other day, before big races like Ironman, I take beets for like a week and a half because they're supposed to help with oxygen consumption. Is that true with the beets?
I am not, the question is that he takes flaxseed oil and you take yeast flakes and beets. Supposedly beets will help with the oxygen carrying capacity, and since he's a triathlete, the honest answer to this, I do not know about beets and I do not know about yeast. I don't look like a triathlete. But I know about the flaxseed, and really my mood is a reflection of adequate amount of flaxseed. Happy, no depression, and so forth. I'm sorry I could not answer your question. Any more questions? Or yes, ma'am.
Well, with the vitamin D, is there like a minimum recommended time in the sun?
They say, the question is how much sun exposure should you get to get adequate amount of vitamin D? The rumors on the street is that if you get into a minor sunburn, you infuse yourself with 10,000 units of vitamin D. So if it was August and it's 12 noon versus October and 4 p.m., you decide how much sun, but you have to have a little bit of redness on the skin. That means that you have a little bit of sunburn, and that is adequate amount of 10,000 units of vitamin D instant manufacturing.
Thank you.
Yes, ma'am.
I usually recommend patients to get the prescription strength of the vitamin D since it's FDA regulated. Do you agree with that, or think that it makes a difference?
So the question is, this young lady recommends that everybody get pharmaceutically made vitamin D because it's more regulated and the amount may be accurate and there's no other material. I have not gotten into the details, but if somebody is vitamin D deficient, it's better to get something rather than to get nothing. A lot of times the pharmaceutical grade vitamin D is in the upper $70, $80, whereas you get 1,000 pills for vitamin D3, 2,000 units once a day for $4 or $5. So there is a financial factor as well that can play into these decisions. So how many, yes ma'am? If I hear the question correctly, that there has been some practice where physicians and patients get 50,000 units once a week. Is that correct? 50,000 units once a week for many weeks, and then they get a stable regimen. About 15 years ago, Henry Ford Hospital were the pioneers because they are in a place where there's no sun. They found all their patients were depressed in the winter and leaving Michigan to come to Florida. So they did majority of these vitamin D studies and did evaluations and found out that this regimen is effective regimen in the treatment of vitamin D deficiency. As we know 15 years later a lot more about vitamin D, that can be a way to correct it, but now just taking vitamin D, a bigger dose once a day, like 5,000 once a day, for a long period of time, could be as adequate and as efficient in replacing replenishing the stores of vitamin D and getting people out of vitamin D deficiency. So if somebody takes that, it's okay, but these are, again, very confusing pills to take once a week. Sometimes when you go down to once a month, you go to the pharmacy and they give you a bottle and a paper and a bag and a receipt for one pill. So whereas you can take 5,000 once a day, it's over the counter. So sometimes we also have to live our life rather than be a prisoner to a medical regimen. Yes, ma'am.
You mentioned vitamin D toxicity. What would one look for as far as overdosing on vitamin D?
So the question is overdose of vitamin D. I'm going to share, I'm glad you brought this up. This is a very interesting subject. If we get vitamin D by exposure to sun, so you go out in the sun from 7 a.m. to 10 p.m. every day throughout the months of May, June, July, August, and September, you will never become vitamin D toxic. And the reason is that the ultraviolet waves will destroy extra vitamin D that is made from more exposure. We have a safety mechanism in our body not to become toxic if it's from the sun. Extra vitamin D can lead to calcium problems. Patients will become hypercalcemic. They will be confused. They'll be hypertensive. They'll get into renal failure. And it's really a medical emergency. Those patients will be taking calcium pills plus vitamin D plus over-the-counter multiple vitamins for different reasons. They're drinking a lot of milk, and that can lead to high calcium. So the signs and symptoms of vitamin D toxicity are vast. Make sure you check your levels frequently and you don't take more than what you're prescribed. One more question.
Well, seems like you've made a study of vitamins. Is there a general multivitamin brand you would recommend?
Okay, well, I'm glad you brought this question up. I will take you back to the first slide. The second slide, connect with nature. So if you need C, get oranges. If you need B, get beets. If you need magnesium, get figs, dates, and walnuts. Those vitamins, yes, are made because what we're eating does not have any vitamins. So rather than get a bar and get a drink and a shake and say, I've got all my nutrition, you did not get anything. Get an apple, a handful of walnuts, you get magnesium, D, aspirin, you get fiber. So reconnect back. If you insist on staying on this artificial diet, just go get the best vitamins you think will complement the deficiencies you're creating for yourself. I think with this, thank you so very much for your attendance. And I have just been notified I have received 4 virtual hugs. So I feel good for today. Thank you.